This segment of Coast Life is sponsored by Beebe Healthcare.
On Coast Life, we talk about how wonderful the coastal Delmarva community really is, but sometimes there are members of our community that are underserved and need a little more access to healthcare and behavioral healthcare options. That's where the Beebe Mobile Health Unit comes in. It allows them to meet the community where they are.
When you need to see a doctor, what do? Make an appointment, see your healthcare provider, and get the care you need. But what about those experiencing homelessness or who don't know their healthcare options? That's what makes the work Beebe Healthcare does with their mobile health unit invaluable to the underserved areas of our community.
The Mobile Health Unit, which is a grant-funded program, and we're incredibly grateful for the funding that we received. It allows us to literally meet people where they are. We've had a robust community outreach team and department for years, decades actually, and this was a way to not only meet the needs of the community by going to where people are, because when you're in the community, you're encountering individuals who might not be accessing care. For years, we've been the only healthcare touch point for individuals at our events, and this mobile unit just allowed us to get out there in a much more robust way with an incredibly dedicated team.
Another essential component to getting the Beebe Mobile Health Unit into the community is the partnerships that Beebe has. They help build trust between healthcare workers and those who need them.
We get out into the community through partnerships. Partnerships has always been an incredible component of our outreach efforts and continues to be with the mobile unit. So I always say it's the trusted door through which we walk. We can't just show up. People don't always know why we're there or what we're doing, what our intention is, what our services are. So it's really through leveraging and tying into and connecting with those community partners who have that presence in the community so that we can then go and create that consistent place-based programming and walking through that trusted door.
In order for Beebe Healthcare to meet the community where they are, it takes a team that's diverse in their expertise and specialties to make sure no gap is left unbridged.
My role at Beebe is to expand behavioral health services in the community, reaching those undeserved populations in remote areas. And also on the mobile unit, my role is to build those community partners that we can connect and not duplicating services, but offer services that are not offered by their organization or other providers in the community.
One member of that team that Beebe is very excited to have on board their mobile health unit is nurse practitioner Gwen Davis.
I meet the patients where they're at. I never know if I'm going to see a medical patient, a psych patient, or a patient that needs help with addiction. We take care of a lot of persons experiencing homelessness in Sussex County.
Behavioral health needs are difficult for anyone experiencing them, but even more difficult without regular access to a healthcare provider. Gwen breaks down the elements that behavioral health encompasses.
Behavioral health encompasses addiction, psychiatric problems, anxiety, depression, or more severe like bipolar or other OCD, other types of psychiatric disorders that interfere with a person's ability to function on a daily basis.
As a nurse practitioner, there's a very real advantage to having Gwen on board the mobile health unit.
I can assess the patients, see what they need, and then I can write prescriptions or send referrals. Sometimes with our patients that are using fentanyl and xylazine, they can get wounds from injecting. And so I can take pictures of their wounds, I can start treatment, I can send them to the pharmacy to buy medication, and I usually consult with our RN, Lori, who works with Dr. Zhang at the Wound Care Clinic.
Recently, the Beebe Mobile Health Unit was awarded congressionally directed funds through Senator Carper and Congresswoman Lisa Blunt Rochester's office to further support their community harm reduction service.
We do a lot of harm reduction here, so we give out tons of Narcan. We teach people how to use Narcan, and we also have lots of condoms on board, things like that to help reduce harm reduction. Pretty soon we're going to be doing HIV testing on board.
That funding will also help them in providing prevention-based education to students throughout Sussex County. Kim Blanch reiterates how grateful the team is for the funding and the grants they've been provided.
So this was all made possible when DSAM, our Division of Substance Abuse and Mental Health, I think back in 2021, offered through SAMHSA, which is the federal level, offered through SAMHSA the state opioid response funding opportunities. And through those opportunities, we were successfully awarded a grant to purchase the unit that we're standing in today. We were also awarded a grant to stand up the peer recovery specialists in the acute care setting, who are now part of the mobile unit team, and then also our behavioral health consultative line. So we now have an outpatient behavioral health practice, all as a result of those 3 state opioid response grants. So incredibly indebted to our state DSAM, the state agency, for their support and recognition of the need. They obviously recognized the need, and we were able to execute on the deliveries, the deliverables through our grants. So then we are now funded through state ARPA, through Governor Carney's office. And as a result of that funding and being successfully awarded those monies, we're able to continue offering this program out into the community. So it continues our operations, and we're just incredibly grateful to them, and then the Carl M. Freeman Foundation for their support in this, the mobilization, literally, of the mobile unit.
If it wasn't obvious, the team with the Beebe Mobile Health Unit really loves taking care of each other and, of course, the community that it serves. We love the community too, and we've got more Coast Life coming your way.